Hi, my name is Brian. I'm a nursing student at Purdue Northwest University. Today I'm going to be inserting an indwelling catheter to avoid bladder distension, also to collect some urine. Before I start though, I'm going to first look at the MD order. I'm going to look for any allergies of the patient. I'm going to look for any allergies, any medication the patient's taking, and I'm also going to check that the patient needs an actual indwelling catheter. So once I look at the MD order, it says that the patient needs an indwelling catheter. So then I'm going to go into the patient's room, knock on the door. Once I knock on the door, I'm going to go inside the room, perform hand hygiene.
Forget I'm just maintaining one. Just let it.
No, you have to speak both of them.
I'm gonna perform hand hygiene, and then I'm gonna go out to the patient. I'm gonna introduce myself. Then I'm gonna explain that I'm gonna be inserting an indwelling catheter. After that, I'm gonna ask the patient to identify himself. The patient tells me his name, so now I'm going to check his wristband and make sure it's the right person. So yes, this is the right person. So now I'm gonna tell the patient I'm gonna start the procedure, and if he's okay with it, I'm going to start. So to start, I'm gonna lower the side rail, the bed rail. Actually, first I'm going to place the bed to proper high position, and also I'm gonna provide a cluster curtain. So I lowered the bed to proper waist level. So now I'm going to lower the side rail. Okay. So once I lower the side rail, I'm gonna put on the blanket on top of my patient to make sure I don't expose them. Okay, so once I lower this, I'm going to remove the blanket. And I'm gonna make sure he holds the one I just put on top of him.
No, no, look at the camera. Look. No, I was gonna put it on top. I'm like, no. Yeah, do that again.
This side.
They're recorded.
Okay, so once I remove the blanket from the bottom, I'm going to put on my waterproof pad under the patient. Before I do that, I'm going to perform hand hygiene and put on some gloves. So I'm gonna tell my patient that I'm gonna put a waterproof pad under him, and I'm gonna ask him to raise his hips so I can gently place it under. Move on to the side. Alright, so once I put on the pad on, I'm gonna raise the patient's legs. I'm gonna put him in a dorsal recumbent position. sure he spreads them. Okay. Right. Then I'm going to remove the blanket and only exposing the part I'm going to work on. Up. Okay. Then I'm going to remove my gloves for hand hygiene. I'll put on a new pair of gloves. Okay, then I'm going to start cleaning up the area. Okay, so I'm gonna start. I'm gonna pull the labia apart. I'm gonna start from the left, go down, and since we don't have another wipes, I'm gonna throw this wipe away, get a new one. I'm gonna wipe down again from the right side. Then I'm gonna get another wipe and wipe from the wipe the labia down to the anus. Okay, and after that, I'm gonna throw away the wipes. Throw them away in the garbage. Okay, so once I throw them away, I'm going to start setting up my catheter. So I'm gonna remove my gloves. Okay, so now that I finished cleaning the perineal area, I'm gonna cover my patient back up.
Today I'm going to insert one catheter. This is
And then I'm going to start opening my sterile catheter. Okay, so for this, I'm gonna use it as a receptacle bag for later. I'm gonna open up my package. I'm gonna start by just touching the outside, running it down, touching the other side, running it down, the other side, and the other side. Okay, before putting on my sterile gloves, I'm going to go back to the patient and open up the area I'm going to be cleaning and working on. Okay, so then I'm going to slide my catheter to a proper position. I'm gonna grab my sterile gloves. Okay, then I'm going to grab it from the cuff. And only touching 1 inch. Okay. Okay, so then once I have my sterile gloves, I'm going to grab my drape. Okay. Make sure it's only 2 inches touching it. Okay. And I gotta make sure that the shiny part touches the bottom. Okay. So then I'm going to slide it under the patient. And I'm going to grab my other drape. Make sure I'm only touching the corners. I'm going to place it on the bottom as well. Once that's set up, I'm going to get rid of my gloves. sterilizer, throw it in the garbage. Alright, after I put on my sterile gloves, I'm going to throw away the package into the garbage. Okay. Then I'm going to grab my drape from the corners.
Okay, now I'm going to set up my sterile.
Okay. Just from the corner. Only touching 1 inch. Okay. And I'm going to make sure that the shiny part is placed under the patient. So I'm going to slide it under. Okay. Then I'm going to grab my other drape, grabbing only the corner. Place it on the side. Okay. Then I'll grab my catheter box, and then I'm going to place it here. I'm going to remove this part, place it over here. Okay, once that's done, I'm going to start by removing the cap of the syringe. Actually, throw this away. Okay. Then I'm going to insert it inside the catheter. Okay, so I'm going to remove this and throw it away. I'm going to insert it inside the catheter. Okay. And once I do that, I'm going to open up my lube, and I'm going to put it on the sterile field. Throw the cap away. Set that to the side. Then I'm going to open up my iodine. Spread it around the cotton swabs. Throw that to the side. Okay, once that's done, I'm ready to start cleaning the patient's perineal area with the iodine solution. So I'm going to grab my tweezers and I'm going to start. So I'm going to this is going to be my non-sterile hand, so I'm going to spread the labial apart, and I'm going to wipe from the left side all the way down, go around, throw it away, then swipe from the right side all the way down, go around, go away, then from the labia all the way down, go around, go away. Okay, so once I'm done wiping, I'm going to grab my catheter. I'm going to spread it on the lube, only 2 inches, 1 to 2 inches. Okay, once that's done, I'm going to grab my syringe. Okay. To grab my syringe. Okay. And I'm going to insert it in the labia. And if the patient is if I feel any resistance, I'm going to tell the patient to take a deep breath as I push it in. So I push it in 3 to 4 inches. Okay. So once the catheter is in, I'm going to inflate it. Okay, once I inflate it, I'm going to pull on it to make sure it's stable. And after that, I'm going to clean up my area. So then I'm going to set this to the side, get rid of it. And I'm going to grab my catheter bag. Before I do that though, I'm going to remove the syringe to the side. And I'm going to strap the tubing to the leg, and with the bag I'm going to place it on the side of the bed rail. But since I don't have the strap, I'm just going to leave it right here. Okay, so after that's done, I'm pretty much going to clean up. I'm going to grab my supplies. Go to the side. Grab my put it to the side. And grab my pad. Put it to the side as well. And I'm going to grab my waterproof pad. And put it to the side. Once that's done, I'm going to put the patient back. The blankets back. Pull his back, legs back to normal position. Then I'm going to pull the cover back up to the patient's chest. And I'm going to slide the blanket back down.
Now I'm going to go over and insert the lubricant. This is so easy, allow me to put the catheter, so it could be more easy for the catheter to go to the Now I'm going to go over and grab my catheter.
Okay, so then grab the blanket and I put it in the laundry.
I'm just going to ask the
Okay, so once that's done, I ask the patient if he's feeling any pain or any pain, if he's feeling good. So then I'm going to raise the side rail.
I'm going to set it onto the white ball. Make sure not to force it.
I'm going to lower it at a comfortable position. After that's done, I'm pretty much done with the procedure. So I'm going to remove my gloves. Remove that from hand hygiene. And I'm going to write the urine, the date the urine sample was collected, the consistency, the color, and also the time. So after that's done, I'm pretty much finished with the procedure.